Hello everyone and welcome to our live conversation on ALLATRA TV Africa. Today our guest is Mohammed Usman, a medical student from Nigeria. Hi Mohammed, thank you for joining us.
Thank you, Olga.
My name is Olga, thank you. My name is Olga and I'm from Ukraine, and my co-host is Habib from Nigeria. Hi Habib.
Hi Olga, hi everyone.
Our topic today is learning to serve humanity. Our guest will share with us his experience on creative society and the 8 foundations of building such a society. Hi Bib, I'm giving you the floor. Could you tell us more about
Hello
creative
Olga,
society?
hello everyone. Hello Olga, hello everyone. Welcome to Creative Society.
Okay, could you tell us a little bit more about Creative Society project? Habib, if you could share with us.
Okay, Olga, yeah. Okay, Creative Society project is implemented in 180 countries around the world by ALLATRA International Public Movement volunteers. The goal is to ask all people how they imagine a creative society where a universal human values such as kindness, love, and mutual help are given all utmost priority. They using the rule of this handshake and thanks to modern information technologies, we are meeting more people. We are meeting more people and awareness about this society of happy, kind humanity in expanding. It's expanding. More and more people are appreciating in creative society. You also can join the creative society initiative.
Yes, and if you would like to be a speaker on our next program, or would like to tell everyone your ideas about Creative Society, please email us at info@allatraunites.com. You can also learn more about Creative Society project of the ALLATRA International Public Movement on the website www.allatraunites.com.
As usual, during our broadcast, we test the 6 handshake rule by asking our guests to nominate someone who will invite to our future live conversations.
Yes, and near the end of conversation, we would ask Mohammed to recommend someone to share with us their interest on creative society. But for a start, we'd like you, Mohammed, to tell us a bit more about yourself. We know you're a medical student, but tell us about your motivation. What really inspires you?
Good evening, everyone. I'm currently a final year medical student from Nigeria. What really inspired me, if I could remember, is a long story. Almost 6 years ago, when we went to General Hospital here in my state with my uncle for a medical treatment. We went there to for a medical treatment because then he was having a cancer problem. On getting there, we met a queue, about thousands of people waiting for doctor. And when I get into the office, I met only one medical doctor. So I told him that we are having an emergency case. He said, no, there is nothing he can do. The only thing I have to wait the way others wait on the queue. So we waited for almost 2 hours, no response. We had to come back to our, we had to come back home and started started thinking of where to go next. What I'm trying to tell you, at the end of the day, he died of the same disease. So that really pains me. from then I promised that I have to go for this medical, I have to study medicine, because I've realized that we have a lot of problems in our country. So that's what really inspired me to go to medical school. So, and to get a slot or to get admission into medical school in Nigeria is not a small task. It's not easy. One has to compete with other students from different parts of the countries. You have to get a good marks for you to get a position to public universities.
Thank you.
Thank you.
How important it is to you that there is free and accessible opportunity for everyone to acquire quality education and realize their potential.
Yes, I'm coming. This phone has problem.
Mohammed?
Sorry,
I'm coming.
can I take the question?
I'm coming.
Mohammed, we don't see you.
I have problem with my
Camera?
I have problem with my camera.
Oh. Okay, as you're trying to fix your camera, we still hear you very well. So would you like Habib to repeat his question? Okay, that was, Habib and Mohammed trying to go back to our live conversation. I want to say that that was a very inspiring story you told us about how did you get into medical university, because of course everybody who needs medical service, this service has to be on time. If we miss out on time, this could be too late for some people, and also it's important to have a good quality help, because it also depends on, like, the life of a person depends on this. How are you doing, Mohammed? We still don't see you. Okay.
Sorry, Oga. Sorry,
No
Oga. I have problem.
No,
I have problem with my connection.
Okay, I'm very happy that you're back, and
yes,
we can continue. No worries.
Okay.
No worries.
Okay.
Why don't Habib repeat his question he asked you before something happened? Habib, could you ask? Yeah.
Hi, dear Muhammad.
Yes, I can hear you.
I want to take the question again. How important it is to you that there is free and accessible opportunity for everyone to acquire quality education and realize their potential?
Repeat your question, Habib. I can't hear you.
Dr. Muhammad, my question is, how important it is to you that there is free and accessible opportunity for everyone to acquire quality education and realize their potential? That's the question.
Okay, thank you, Habib, for your questions. I think it is very important for everyone to acquire the good education in Nigeria. I mean, yes. One thing I know, before I go to medical school, there are a lot of examination that you have to pass through before you get into medical schools, and
Connection is not the best today.
it could of any profession.
Mohammed, yeah, we didn't hear
you
you at some point. At some point, we lost you, and we haven't heard what you said. Could you please repeat your answer?
What I'm saying is that it's very important. I said it's very important for someone to pass through some series of tests before he gets to a particular position. because that will determine who you are going to be. So it's very important, it's very crucial. That's why I try to give example with myself. Before getting to medical schools, I passed through a series of tests before getting admission into medical schools. And I'm very sure anybody that passed through the same process and at the end of the day get into medical school is going to be a good someone who be a good medical doctor.
Yes, thank you very much. So, do you think that everyone should have free access to good quality education?
Hello? I can't hear you, Oga.
You can
You said?
hear me?
I can hear you now.
You can hear me. Okay. Do you think it's very important for everyone to get good quality education?
Yes, it is good, and it's very important for everyone to get a good quality education because it has an impact on our day-to-day activities and even on our economy. So, because at the end of the day, all of us who found ourselves working in the same sectors. So if we didn't get a good quality of education, it's going to have an impact on our day-to-day activity. Just for instance, like as a medical doctor, if you haven't go to a good medical education, at the end of the day, you'll find yourself killing people or doing unnecessary things.
Yes, yes. Thank you very much for your answer. Could you please share with us your vision on medicine and healthcare services for all people, rich or poor, young or old? Do you think many people are getting access to quality healthcare services?
I can only talk about Nigeria, where I am in now.
Yes, sure.
In Nigeria, I think in Nigeria currently, not everyone get access to good health in Nigeria, and there are many factors that contributed to that. Number one is in Nigeria is poor health infrastructure. Because in Nigeria here there's something we call three-tier of government. That's what we run. That's decentralization. In Nigeria, we have three systems of government in Nigeria. We have federal, that's at the higher level. We have state healthcare system. We have local healthcare systems. And these three healthcare systems are controlled by the three government I mentioned earlier. I said the higher, that's the federal institution, the federal healthcare system is controlled by the federal government, that's at the top, while the state government control the secondary healthcare system, while the local government control the primary healthcare systems. So that is what, and the problem we're facing now is that most of the population, I can say 3/3 of the population of Nigerians dwell in rural area. That's, I can say 70% of Nigerian people dwell in rural area, where 30% live in urban areas. And most of these healthcare services are confined within the urban areas. So that's why due to some other factors, like I mentioned, the underemployment, like unemployment, poor sanitation, lack of education, that's illiteracy, they cannot get access to these services. And I can tell you most of the death rate, the mortality rate, I mean, when I say mortality, that is the death rate, that is the infant mortality rate, the maternal mortality rate, that's women that died in Nigeria. Most of them, they are from rural areas, not in urban areas, because most of them, they cannot get access to the healthcare system in the urban. And the duty of this healthcare system I mentioned, that are divided into three categories. Like the top level, that's the federal care system. They deal with university teaching hospitals, like where I am in now as a medical student. They deal with federal medical center and university teaching hospitals, where you can find experts, the professors, the consultants. That is where you find experts, and they are located in the urban areas. So federal government take care of this. Why the state level, the state only deal with secondary healthcare system like general hospitals and the specialist hospitals. So what happens is that if there is any complex cases in the rural area, the health professionals from the rural area will refer patient to urban centers. And for them to refer patient to the urban center, they require a lot of things like good road, transport system, which we like in Nigeria. So that is what is contributing to a lot of problems in Nigeria. I think to mention but few, but there is a lot. And again, in terms of employment, we have an expert in Nigeria. We have good doctors who are busy migrating to abroad for, I don't know, because of the problems we're facing. So we have experts, but the problem we have here is employment. Our government doesn't employ medical doctors and distribute them to various places where they are needed. So I think government should try to do this. And again, another problem, as I told you, that we practice decentralization. What I mean by decentralization, every locality should be able to control its healthcare system. That is what I believe. But the problem is the federal institution from there that will, what I'm trying to say is that if I compare, I'm from Africa, if I should compare the Nigeria healthcare system with Ghana, our neighboring country here, what they do is that if a medical doctor, a graduate, fresh graduate, what they do is federal government that will post you to anywhere they want. They can post you to rural areas, but there is package for that. You can be even in more than someone that is in the urban areas. So I think that is what drives most of their doctors to the rural areas. But in Nigeria, reverse is the case. Doctors don't like moving to rural areas because they believe there is no opportunity and insecurity and many factors. So they don't like moving to there. The people that are only confined, the only people that take care of the primary healthcare in the rural area, they are not a qualified medical professional. They are not doctors. Most of them, they are just community health practitioners, and they have been doing a lot of damages. Yes.
Yes, thank you very much.
Thank you.
Thank you very much. Thank you, Dr. Muhammad, for your wonderful explanation. We really appreciate that. I want to ask you some few questions here before we move ahead. If I understood what you just explained, people in the rural area, they don't have access to healthcare systems in the rural area, right?
Yes.
And then I want to know why is it that those in the rural area, they don't have access to good healthcare system? And then what is the cost? You understand what creates, you understand, the causes, you understand, of unequal, you understand, unequal access to healthcare system. Because if I understood, those that are in the urban area, they have access to healthcare system, but those in the rural area, they don't have access to the healthcare system. So what caused this barrier? We are all the same human beings. We all need to have the same access to healthcare system. Anywhere you are, your location, your tribe, you understand, doesn't matter. We are all human, and we all have right to equal healthcare system. So from your explanation, the people in the rural area, they don't have good access to healthcare system. What will be the solution for that, and what is the cost? Dr. Muhammad, a medical student. Thank you.
Thank you. Sorry, Habib, I'm not yet a doctor. I'm still a medical student. Stop addressing me as a medical doctor. Thank you for your questions. I've already stated it earlier. What caused this inaccessibility of rural people, or let me say people from rural area to healthcare system? Number one is unequal distribution of health resources. Can you hear me? Can you hear me?
Yeah, we are with you.
Yes.
Okay. Yes, I said unequal distribution of health resources. When I said unequal distribution of health care resources, they comprise of many things. Number one, I've already stated earlier that we practice decentralization in Nigeria. What I mean by that is that local government, that's primary healthcare that is located in the rural areas in Nigeria here, they are being controlled by the local government, not the federal government at the top. And these people cannot cater for what they want. They cannot take care of these things. Most of the resources, most of the resources from the federal government, most of the resources are coming from the federal government. And before getting to the rural area, most of these resources will be embezzled in the state level, might not be able to get to the rural areas. That is number one. And manpower too is very important. Manpower, what I mean by manpower is the healthcare professionals. Healthcare professionals doesn't like going to the rural areas. And I told you the reason. The reason is because they are receiving the same salary with the people in the urban areas. And there are a lot of problems in the rural area, like insecurity that I mentioned, you understand? And some social amenities, electricity and good roads. So they don't like moving to there. And some, they consider the education of their children If they go to the rural area, they might not have access to all this. So that's why they don't like going to the rural areas. Healthcare professionals don't like going. Most of the healthcare professionals that are posted to the rural area, they are not qualified. They only have certificate. They are not medical doctors. So, and you see, most of the people dwell in the rural area. Most of the patients that we even receive here in the institution, medical institution here, most of them, they are from rural areas. So before getting to there, most of them will be having, it's only when damage has been done, they will be coming. Because those people will not live there. Maybe it's an emergency case. They can't just look at them. They have to do something before referring to the higher institutions. Understand? That is it. And also, the community participation is also crucial. Sometimes in the rural areas, as a medical professionals, you don't just enter. If you go, I think what government is supposed to do is that when they posted medical professionals into rural areas, the medical practitioners should try to like collaborate with the community leaders and the people. If possible, they should try to get some of the members of the community, train them, like try to train them in some like even if it is first aid and other things, they should try to train them. I think try to collaborate them, try to bring them into the healthcare system in that particular area, and that will increase the compliance and other things. Maybe I think that is very important. And there are other factors again that contribute to this poor healthcare system in the rural areas. Number one, we call the intersector. There are not things that are related to health. Like number one is poor sanitation of the environment. You understand? In rural area, as you know, there is poor sanitation. Number two is lack of good food. Rural areas, people, they lack food, and this can contribute directly or indirectly to their health. Again, is unemployment. Most of these people in the rural area, they don't have employment. They rely on farming, so they might not have access to the hospital. They might not cater for the hospital. They might not afford the hospital bill, and the hospital bill in Nigeria is expensive, so they might not afford it. There are a lot of things. I think we mentioned but few. And
thank you very much.
Okay.
Mm-hmm.
Solution.
Yes, thank you very much. Yes, that was my next question. Actually,
okay.
you mentioned many, at least main problems, you know, in Nigeria, in rural areas, and I would like to ask you, like, assuming you become the chief medical director in your hospital or your country's minister of health, what changes would you like to see in the provision of healthcare services? What would you change? What changes there should be?
Number one thing, I think the first thing I would try to do is that word that I mentioned, the decentralization. I would try to centralize healthcare system. That is number one thing. What I mean by centralizing is that I will make sure that each locality will take care of its healthcare system. Like I said earlier, the rural areas, the people in the rural area, all the resources that are for the local government should be allocated directly to the local government. I mean, should be allocated directly to the rural areas. They shouldn't pass through anybody because of the corruption we are facing in Nigeria. That is number one. And secondly is the manpower. The manpower, I'll try to make sure that the medical doctors that move to the rural area earn more than those in the urban areas. And I will try to make sure that their children, I provide good education for their children. For instance, I'll ask them to stay in the urban areas, the children, while the doctors should move there. And they will be provided with good houses and many things the good things that they need in the rural area to live. And their salary is going to be more than that of the professionals that live in the urban area. And thirdly, again, I'll make sure that the communities participation. I will make sure that the members of the community participate in the healthcare systems. They know more about the healthcare system. And even because the problem we have here is health education. Now, people doesn't have health education. They don't even know about their disease conditions. It's only condition that solution to your problem. Some of them, they're having disease. They don't know that they're having disease. For instance, I can give you an example with cancer disease. In Nigeria here, people didn't even know what is a cancer disease. Because most of them, they'll be having disease, but they'll be thinking it's nothing. It's just they call it something else. You understand? They don't even believe it. And most of them, they delay. They spend a lot of years before going before seeking for medical treatment, and that will worsen the conditions. So they need healthcare education. So I'll make sure that I send healthcare professionals that are expert in this aspect to rural areas to educate them. And also medical school, I'll try to do what is called, I don't know, I will move to different secondary schools, do this orientation, tell them about medical schools, try to draw them to medical schools so that we'll have a lot of practitioners. And I will try as much as possible to increase salary of medical practitioners in Nigeria so that they will not be fleeing to abroad. Because it's because of the low salary we have, poor salary we have in Nigeria, that's why they are moving to abroad for good salaries. So I'll try to increase the salary so that people will not be fleeing out.
Thank you very much. Education is very important.
Yeah.
Education is very important. Education is very important, Oga. Yeah, it's very important.
Thank you so much, Muhammad. We heard you and we really appreciate the way you are putting us through. Now, take for instance, you and I as an example, as individuals, do you think we have any role to play to ensure quality and accessible healthcare system in our society?
Yes, thank you, Mr. Abud, for your wonderful questions. I think you and I have a crucial role to play. As I said earlier, you must not be a doctor to contribute to healthcare systems, as I said. Understand, as a man, you can contribute to different aspects. You can, like I said, you can build schools in your societies. When you build good schools in your societies, what you are doing, you are trying to educate people. You understand? When you educate them, that is when they will even have that thought of moving to medical schools or anything. Without education, we can't get to where somebody like me, I can't get to where I am now. That is number one. And you can provide a good housing or good water for your people, like locality where you stay. If you have ability to do that, you provide good water for them, good road for them, I think it will help them. Because most of the disease conditions we have in Nigeria, they are communicable disease. They are infection. Disease conditions acquired from what we eat and environment. So providing good road, even you as an individual, where you clear your environment, if you clear your environment, you drink good water, and this will protect you from these disease conditions. That's number one. So there are different ways we can contribute, either financially or, and even health education. You can educate people. If you have the knowledge, you can educate people on their health, tell them about their health conditions, because most of them, they don't even know what is happening to them. They don't even know what they're doing. So that is why it's ignorance. So education, number one, good environment. As good environment is very important. Good environment. If you stay in good environment, you have good housing, good environment, take good food, I think you are safe.
Thank you. Thank you very much for your vision on it. It's very important what you just shared. And today, most services are given for a gain, for profit. Can you sum up for us how you envision service provision in creative society? You already talked about it, but maybe just sum up what you just said.
Olga, repeat your question, please.
Okay, sure. So you just mentioned that every person can be a great contribution to the society where good education, good services, and it's important that people respect each other, right? And appreciate the human life itself, right? Because if you appreciate the human life, other people's lives as your own, you will be there. You will share your water, share your food, share your knowledges, like you said, educate other people if you're able to share some knowledges, right? So what I wanted to ask, to say that most services today are given for a profit. People expect money for their services. And can you sum up for us how you envision service provision in creative society? how it should be?
To me, as you said earlier, it's true that like in Nigeria, most of the healthcare services are privatized in Nigeria. That's why the poor find it difficult to get access to the healthcare services in Nigeria. So I think the way to tackle this problem is as a medical doctor or as someone, you must not be a medical doctor. There are even some that have hospitals. They are not a medical doctor, but they hire medical doctors in these hospitals. So there is a way you can help poor. How will you help poor? Number one, you can reduce the hospital bills, number one. And that's one. That's individually as the individual. And government too can provide health insurance. Because I can tell you in Nigeria, only 5% of Nigerians have health insurance in Nigeria. That's why we find it difficult. Only 5% out of 100% have health insurance. So as an individual, if you have a hospital, there is a way you can subsidize things. You can reduce the hospital bills if you are willing to help. Assuming if government hospital is billing, let me say $20 per consultation, you can reduce it to $10 per consultation. By doing this, you are helping poor. And I can give you an example. I'm from rural area. As I'm speaking to you, I'm from rural area. I know whenever I go to holiday, I go to my village, I do contribute. Sometimes I don't even collect money. I do go to my primary health care, render some simple service that I can help without even charging. Like try to educate them. I can go to my community, gather them, tell them some things, simple things, more of preventive medicine, how to prevent themselves from acquiring some illness in the society. So I think the most important thing, because most of the healthcare services in Nigeria are privatized. So I think those that are the owners of these private hospitals to try as much as possible to reduce the bills, because before, I think, because rurals, if you are a rich person, you easily get, because to get into public hospitals is not easy because of the population I mentioned earlier. The doctors might not attend to you on time. But private hospitals, there are a lot of private hospitals where you can go and get what you want. But as you said earlier, the financial aspect is something important. And we're in a poor country. So most of our people cannot afford this. So I think by reducing the bills, I think one can help.
Thank you. Thank you very much. It's very interesting. I just want to tell our viewers that please leave your comments below the video. We'll really appreciate it. And it's very interesting what you think and what you have to say on our conversation.
Thank you, Olga. Thank you.
And don't forget that if you would like to participate in our live broadcast, please contact us on the email info@allatraunite.com that you will find below this video.
Now we'd like to move on to the 8 foundations of creative society. I want to ask our technical support to put the 8 foundations on the screen. Muhammad, I know that you was able to see the article 8 foundations for building creative society before the broadcast. By the way, you can easily find this article on ALLATRAUNITE.com website for those viewers who hear about it for the first time. And I would like to ask you, would you like to share with us which foundation you would like the most and you would like to talk more about?
Thank you, Olga. I think among the foundations, I like all the foundations, but the one I would like to talk about that is related to today's discussion is justice and equality. Justice and equality. As I said earlier, every human being in the world deserve justice, and the resources should be equally distributed to everyone in the society. Like I told you in our you can see the problem we discussed today is lack of that unequal distribution of resources that lead to health problems in our Nigeria, in our country. If there is equal distribution of resources, we will not be where we are today. So irrespective of where you come from, irrespective of who you are, educated or not educated, rich, poor, irrespective of your locality, whether you're in urban area or rural area, resources should be distributed equally, should reach you. So we all deserve this. And even employment, we are having problems with employment in Nigeria. I think employment should be distributed equally, because Nigeria is who know you. You have to know someone in Nigeria for you to get what you want. I mean, to get employment after much, I can say after 5 or 6 years of education. So you have to know somebody for you to get work. So I think this should be distributed equally, irrespective of who you are, where you come from.
Yes, of course. Thank you very much. And human life is very important. And if we don't have this equality, for example, medical services could be coming too late. And the most important thing is human life. So people should be equal and getting the medical help on time, right?
Yeah, thank you, Olga. That's right.
Okay. Now is the time to test our role of handshake. Our dear friend Muhammad, could you please give us the name of your nominee for our future broadcast?
Hello, I can hear you. I can hear you, Habib. I can hear you, Habib. Actually, I wasn't aware of this. I haven't nominated anyone. I haven't nominated anyone, so I don't want a social whereby I will nominate someone. At the end of the day, the person will not turn up, so it's disappointment. But I think whenever I did that, I will try to contact Habib.
Of course, you can think of somebody and give his contact later.
Yes. Thank you.
So this person could participate, and you also can participate as the co-host.
Thank you. Thank you.
Yeah. Thank you very much. We will contact your nominee as soon as possible. If you have any nominee and you give us, we will contact him as soon as possible, Muhammad, for the next time. And do you know that you can also participate as a host during the interview? If you happen to give us any nominee, you can be with us as co-host for the next time during the interview. Thank you.
Yes, of course. Of course, okay, you can participate also. And
I also. Okay, Olga, I have a question for you.
Yes, of course.
Okay, my question is, will I have opportunity to participate again in future? I don't know. The participation, is it once, or one can participate multiple times? I don't know. More than one time? I don't know.
Of course, we welcome you to participate more and bring some of your friends. You can participate as a host, like Habib just said. And this is one of the ways we expand awareness about the society of our dream. How else can we make it happen? So we invite you, we invite everyone to join the Creative Society project. And I also want to mention that to join the project is very, very simple. You just have to visit the website, allatraunites.com, click on the red button, join. Maybe our technical support will show us the little learning video, how to do it. And you click on the red button, join, fill in a very, very short form, and start participating in Creative Society project.
Thank you.
Here it is.
Thank you very much, Olga. I really enjoyed today's discussion, and it's really interesting. In fact, when I went through your website, I saw many things like the 8 foundations. There's something interesting that everyone would like to participate. I'm very sure if I invite my friends, they will be they won't tell any of them that that's it.
Yes, dear viewers, if you love this broadcast, please share it in your social media using the hashtag ALLATRA Unite and Creative Society. Remember, the quicker people know about the Creative Society, the faster it can become a reality.
Thank you, Mohammed. Thank you, Hadib, for such
Thank you,
an enriching and warm conversation. Thank you to our technical support. And thank you, everyone. We look forward to seeing you all soon again on ALLATRA TV Africa.
Thank you, Olga.
Thank you, Olga.
Thank you.
Good to see you once again. Yeah.
Nice to meet you.
Yeah. Bye.
Bye. Nice to meet you.
Nice to meet you too.